Vasopressin. So we're gonna learn today about the factor that increases the production of vasopressin in our body. What is the mechanism of action of vasopressin? What are the indication and the side effects? So first of all, the mechanism of action in that one will look like what are the factors that actually releases the vasopressin. And before that, what is vasopressin? So if you have heard the name of antidiuretic hormone, antidiuretic hormone, ADH, that is vasopressin. Now, what factors that increases the release of ADH in the body is hypovolemia. So if you have a fluid loss, blood loss, basically a low volume of fluid in your body, that's going to increase the release of vasopressin or ADH. If you have a decrease in blood pressure, that would definitely increases the release of vasopressin. Low perfusion to kidneys, basically the RAA system. So if you have watched the video of RAA system, you would know that the decrease in kidney perfusion will initiate the RAA system, and that would increase the secretion of ADH. And also the increase in blood osmolarity. Now that's basically concentrated blood. And when concentrated blood means there is a loss of water, that would trigger the secretion of vasopressin. Where is vasopressin get secreted from? So in our brain, there is a called hypothalamus. And in that one, we have a pituitary gland. And there are two parts of pituitary gland. Two sections. There is an anterior pituitary gland and posterior pituitary gland. And from the posterior pituitary gland, the vasopressin gets secreted depending on all the signals that body sends to the hypothalamus, which is in the brain. Okay, like the signals like a hypovolemia, decrease in arterial pressure, low perfusion to kidneys, and increase in blood osmolarity. So what is the mechanism of action of vasopressin? There are two main mechanisms of action of the vasopressin. Let's look at the first one that works on vasopressin, the mechanism of action of vasopressin on kidneys. So the main functional unit of kidney is nephron, and I'm not really great at drawing, but this is Bowman's capsule, and then you have this is proximal convoluted tubules, that's loop of Henle. Then you have a distal convoluted tubules, and you have here the collecting ducts. Now this is kind of divided in two parts. This part is cortex, this part is medulla, like a renal cortex and a renal medulla. So let's say this is proximal convoluted tubule. This whole part is loop of Henle. This is distal convoluted tubules. Now we are interested in this portion, which is collecting ducts. Now whenever there is a decrease in perfusion of kidney, decrease in arterial pressure, or there is a low volume in the blood, the low volume in body vessels, what it does, it sends signal to the hypothalamus and say, hey, we have a problem here, like a decrease in blood pressure, or there's something wrong, we need more fluid in our body. Then hypothalamus sends signals to pituitary gland, especially the posterior pituitary gland, and tells it to release the ADH. Now when it gets secreted in our body, it comes to the collecting ducts, and what it does, it increases reabsorption of water in collecting ducts. So here you have a urine going through, and it's gonna go to the bladder and gonna get excreted. What happens? ADH comes here and works on this collecting ducts and makes it more permeable to water. So this is mostly all the thing right here in medulla. It's all salty, like there's a high concentration of sodium. So this whole part is salty right here. Now when the ADH makes this whole thing permeable to water, which usually it's not, if there's no ADH here, then it's not really permeable to the water, so the waters can't pass through these collecting ducts outside, so it just gets excreted through the urine. But when ADH makes it permeable, the water moves from here from urine to out in here, because this part is salty, so the water is going to move from low concentration to the high concentration, and that's how the water gets reabsorbed. And this then goes back to gets reabsorbed because you have like a whole network of arteries and veins and everything right here that gets this water gets reabsorbed back to the blood, and it increases the fluid volume, and that will increases the blood pressure, will take care of the will also increases the fluid volume, and it will increase so if you go back to the slide, they will take care of the hypovolemia. So by increasing the fluid volume, it's going to take care of the hypovolemia, it's going to increase the arterial pressure, it's going to increase this perfusion to the kidney, because it's going to increase the blood pressure, and fluid volume is going to get, kidney is going to get more perfused. And so it's going to decrease in blood osmolarity. That means blood was concentrated, now more water is getting absorbed. It's going to dilute the blood, and it's going to make it less concentrated. So that's how it works in the kidneys, and those are the effects that vasopressin has on our body through the kidney. Now there is another effect it has on arterial blood vessel. So there are vasopressin receptors on blood vessels, especially the arteries. So when vasopressin gets secreted from hypothalamus, especially the posterior pituitary gland, it goes and binds to this vasopressin receptor on our blood vessels, arteries, and it causes the vasoconstriction. And that's gonna increase blood pressure as well. Now here's the main point. In our body, we have antidiuretic hormone present all the time. However, the physiological concentration of ADH or vasopressin is so low that it does not cause the vasoconstriction. So normally we all have vasopressin or antidiuretic hormone present in our body, but the level is not that high that it will cause the vasoconstriction. But let's say if someone having a low blood pressure, then you would put them on the vasopressin drips. That concentration is really high than you found normally in a body, and that will cause the vasoconstriction. So to cause the vasoconstriction, it requires higher concentration than normal physiological concentration of vasopressin. So that's one of the mechanism of action. It increases the blood pressure as well, and also works on kidney, as we talked in the previous slide. And usually you see this vasopressin drug in critical care. if someone having a hypotension, then they will put them on the vasopressin IV drips. So that's the main use. Let's say what are the indication. So if you have heard about the diabetes insipidus, in diabetes insipidus, what happens is basically there is a decrease in ADH in our body. Okay. Now, when there is a decrease of ADH in our body, kidney will excrete more water, because as we talked in the previous slide, this works in collecting ducts by increasing the reabsorption of water. While if it is there are two types of diabetes insipidus. We'll talk in a bit about that too. So when there's a problem in ADH, let's say, then a kidney won't be able to reabsorb more water, and it will excrete through the urine, and basically that's diabetes insipidus. Now there are two types of diabetes insipidus. One is neurogenic, another one is nephrogenic. Now, as we all know now, that the ADH gets secreted from the posterior pituitary gland. So if someone has a problem in posterior pituitary gland, let's say if they have a resection of posterior pituitary gland, then ADH doesn't get secreted from the brain. That's why it's called the neurogenic. And if your body doesn't have enough ADH, kidneys are not going to be able to reabsorb more water from the collecting ducts, and that's how our body gonna lose more and more water. That's basically diabetes insipidus. And also, since I work in the neurocritical care, and we see those patients a lot that they have neurogenic diabetes insipidus, since they have like a tumor of the pituitary gland and they get that resection of pituitary gland, then their body won't produce any more ADH because there is no pituitary gland left. Now, another one is called nephrogenic. Now, their nervous system is intact, their posterior pituitary gland is intact, is secreting enough antidiuretic hormone, ADH, means vasopressin as well. However, their kidneys are not responding well to the ADH. So even though they have enough ADH in their body, the kidney won't be reacting to the ADH because a certain reason could be like a damage, trauma to kidneys, change in structural changes in kidneys as well. So because of that as well, kidneys gonna lose more and more water and won't be able to reabsorb that water from the collecting ducts. So now, since we talked about the diabetes insipidus, we can say that what are the symptoms of diabetes insipidus? Like, they are losing more water through the urine, so they will have a frequent urination. Their urine will be dilute because they're losing more water in urine, so there's like pretty much water. And I've seen patients with the diabetes insipidus that their urine looks pretty much like clear water. Concentrated blood. So what will happen if this one happens, concentrated blood, they're all the electrolyte like sodium, potassium, calcium, their values will go up. And that can cause, like if sodium's going up, it can cause the neurological change, confusion, level of consciousness change. Potassium can cause cardiac arrhythmia, and calcium and magnesium will go up as well, and they'll cause like a problem in muscle contraction and so forth. So there was a little bit overview about the diabetes insipidus. So since you understood what happens in diabetes insipidus, basically either their brain is not producing enough ADH or their kidneys are not reacting to ADH. So we have to give this vasopressin from outside. in order to prevent body losing more water. Now, we also give this one for low blood pressure, and you'll often see this vasopressin given for low blood pressure in critical care, and as a drip, not as a pill or a tablet. And this is a kind of like a temporary fix for the blood pressure until we find a real cause. So we use this for diabetes insipidus and low blood pressure mainly. All right. So what are the side effects of vasopressin? So the main side effects is headache, nausea. Nausea is pretty much for all medication, but the headache, bronchoconstriction, abdominal cramps, now water intoxication, and hyponatremia. Those are the main ones to understand. So let's talk about that a little bit. Now, if you're giving vasopressin, it's gonna work on kidneys, and now kidney gonna retain more water. Now what happens if kidney retain more water? You can have water intoxication, or like hypervolemia. Now, since this one is reabsorbing only water, remember this is the main difference. Like, it only reabsorbs the water. Now, it's only reabsorbing the water while it's not reabsorbing extra sodium, potassium. So it's gonna pretty much stay the same in body while the kidneys are reabsorbing more water. So the blood's gonna get diluted blood. And from there, it's gonna cause decrease in sodium, decrease in potassium, decrease in calcium, all electrolytes. It's gonna decrease in all the electrolytes. And one of the main one it can do is sodium. I mean, all the electrolytes value is gonna go down. So let's say, for instance, if we talk about the sodium, it can cause the hyponatremia. Now, what are the symptoms of hyponatremia? Mostly the nervous system changes, like a level of consciousness changes, dizziness, confusion, so forth. If they have a hypokalemia, it can cause the hypokalemia. They'll have the cardiac changes, cardiac arrhythmias. So those are the main symptoms they usually ask in NCLEX. Like, so patient is on a vasopressin, and if they're having a change in level of consciousness, now patient's not awake, they don't respond to the stimuli. What would you do? And then the main reason those symptoms are caused by vasopressin. Or they may ask you, like, these are the symptoms, what do you think, the patient's on what medication? And they'll give you the list of medication, and mostly because of the vasopressin. And what are the examples of the this vasopressin? First of all, you will see the vasopressin used as a IV drips in critical care. So that's IV drips. Now here is desmopressin. That is a tablet form. And whenever, as I talked to you in a previous slide, I've seen many patients with the diabetes insipidus now, because if they have a pituitary gland tumor, they get the pituitary removed. Now that's a permanent problem. The pituitary is not there anymore. What will happen, especially the posterior pituitary? They don't have any pituitary gland in their body to make the ADH. So usually they put them on the desmopressin. Sometimes body gets adjusted to this not having a pituitary gland, but what if it doesn't? Then they have to put them on desmopressin when they go home, and that comes in a tablet form. And when they are on desmopressin, they have to do the frequent labs as well. When they're on the desmopressin, to make sure they're not getting water intoxication and all the electrolytes are staying within the range. yeah, so that was it about the vasopressin. If you have any question, you can contact us or email us. Thanks for watching.